I want to agree with the line from the member for Kooyong at the very end there, that this is not just a women's problem, because women's health is important for all of us. If we don't get it right, the woman pays a price, but our whole society pays a price. If we don't understand the unique challenges that women go through, if we don't do the research, if we don't care, if we dismiss their pain, she suffers, but we all suffer. And it was something that my family suffered. My paternal grandmother, there was an unspoken story in our family for a very long time that after giving birth to my father, she wasn't quite right in the head. And there was a period where my father was temporarily taken away from her. We never really spoke about it, didn't really know why, and it was something that was very much left undiscussed in our family. And when I had my own son, and I had the extraordinary care of early childhood nurses and GPs, they sat me down and spoke to me about the potential postnatal depression symptoms to watch out for. It was then that I realised what my paternal grandmother had gone through. It is very likely that she had been suffering from postnatal depression, and instead of receiving the care and support that she would have been provided had she had my father a little later on or in Australia, instead her symptoms were dismissed and she had her child taken away from her. And it is that story which really inspired me to have a women's health forum in my electorate, and I loved having the Assistant Minister for Health, Jed Carney, there. And in this place, we are privileged to serve alongside some extraordinary members of Parliament, but I have to say, if I were to have a favourite, the Assistant Minister for Health is certainly right up there. And she is an inspiration for the work that she does in this place, but also the work that she did prior to coming in here. And her nursing background, I think, has really guided the extraordinary work that she continues to do. And in that room, alongside the Assistant Minister, we had some extraordinary women panellists. Janu Daya Nathan, who's the Ambassador for Children's Tumour Foundation, and she has neurofibromatosis. She shared some really personal examples of how she was dismissed in the healthcare system. And Sue Avani, who founded Hathi in the Room, a organisation designed to help break down the stigma of mental health in the subcontinent community. I was inspired by these panellists and really appreciated the honesty and frank discussion that we were able to have that night. And there was extraordinary moments then, quite emotional, but so many women shared their personal stories of how their pain was dismissed in the medical system. And so I'm really excited to be part of this government that is taking women's health seriously and putting it at the very forefront of our agenda. And I thank the Minister for Health and the Assistant Minister for Health for doing that. We have put significant funding into ensuring that women's health is improved at the very research and data collection level, right through to improving women's health outcomes when it comes to maternity care, when it comes to research into miscarriage and pregnancy loss, so we have greater understanding of why that's happening and how we can prevent it, through things like longer consultations for patients with complex gynecological conditions. There is so much work that has been done in this space, and it's something that I'm extraordinarily proud of. At the very local level, I have convened a women's health reference group, and it is full of wonderful local GPs and physiotherapists and gynecologists who really want to do things at the local level. And I'm inspired by the words of a local physio who said, "There is no reason that women should have to live with pain." And Georgina Claxton, I think that is a motto that we all ought to live by.